Hi, I'm Tobe Hanson, Bay Area sports injury specialist and muscle and joint pain eraser. Do you have pain in the neck? Do you have a sharp, acute pain in the neck that makes it hard for you to turn your head? Or do you have a chronic, achy pain that won't go away? Maybe you have a neck pain that keeps coming back. It's reoccurring. Are you tired of going to the chiropractor to have your neck adjusted, realigned, maybe once, 2, 3 times a week? You get great relief only to feel the pain come back again. Or are you tired of going for massage therapy? Feels great, great relief, but shortly after the pain is back. Did you ever wonder why? Why do I have pain? Why is the pain coming back? Why is the pain not going away? When we cut ourselves, we get a wound. The wound will heal if we don't pick on the wound. What does this mean? If we have a neck pain that won't go away or keeps coming back, something is picking on the wound. In other words, we are treating the symptom of the pain, but we're not taking care of the cause of the pain. If the cause is still there, the pain will keep coming back. We're so conditioned in the West to treat the symptom. We take pain pills or anti-inflammatory to deal with our pain. If we have anxiety or depression, our doctor will prescribe us anti-anxiety or antidepressant medication. If we have heartburns, the TV commercials tell us to get anti-acid medication. But all we're doing is we're treating the symptom. And once the medication wears off, the symptom comes back. This means that we're not dependent on something outside ourselves, a drug, to get better. We feel powerless, we keep taking the drug. And we keep hearing that if you keep taking the drug or medication long enough, you might have side effects. Side effects that could even be worse than the condition you originally took the medication for. Same thing is with most treatment methods. Most chiropractic and massage therapy treatments is just dealing with the pain. Even if you adjust the vertebra and your neck feels better, and then you have to come back and readjust the same vertebra, there has to be a reason why that vertebra keeps moving out of position. The vertebrae does not just move by themselves. They're pulled by muscles unless there's an acute trauma or impact. So what happens is, if you imagine the spine and the vertebrae, there are muscles. Muscles in the front of the vertebrae, in the back, on the sides. And when those muscles contract, the neck is either moved forward, moves back, moved to the side, or rotates. There's also small muscles between the vertebrae that help with side bending and rotation and forward movement and back movement. Now, just as like your car, when the wheels are not aligned and the car pulled to the left and pulled to the right, what happens is you keep wearing your tires unevenly. Also, the car is not functioning or performing as good as it should because it cannot go in a straight line. It has to constantly compensate for a pulling force to the side. It's the same thing with your body. When the muscles around your neck are pulling different, then they are pulling the vertebrae towards the tighter, more contracted muscle. Now, this keeps then compressing nerves or causing muscles to be inflamed or fatigued. If you then keep adjusting a vertebra and the muscle is still tight, keep pulling it out, it's going to keep happening. Great, you say, well, I go and do massage. Well, the key is to know which muscle to relax, because I don't really want to relax all the muscles. I want to figure out exactly which muscle is tight. Why is this muscle tight? How can I relax it? There's cause and effect, action and reaction with everything in life. When you have pain, there has to be a reason for it. Did you ever stop and wonder why? If you have to go to a chiropractor or massage therapist frequently and over and over and over, then you're still treating a symptom. All you're doing is giving yourself relief, but the underlying cause of the reason why the vertebra goes out, why the muscle gets tight, is still there. So what caused this tension in the body? What caused the muscles to tense up? The answer is stress. So then, how do we define stress? Most people think of stress as mental, emotional stress, financial stress, relationship stress, performance stress. But the fact is that there's such a thing as physical stress. Overuse, use, and abuse, being in a compromised posture for long periods of time, as well as physical stress in the form of impact or trauma, like being in a car accident, having a whiplash, playing football, snapping your neck over, getting a stinger, or falling off a horse, or falling off a bike, or falling skiing. There are many physical causes, and most of us keep thinking that the physical cause is what causes the pain. Well, I sit in front of the computer all day long and my neck is killing me. Or my sciatica is killing me because I have to drive 2 hours commute all day long. But the fact is that it's not only the physical strain of being in a compromised posture for a long time that causes the tension and the pain. Many other factors come in. So we already talked about the physical stress. And we mentioned the mental, emotional stress. What about your state of mind when you're sitting in front of the computer? Are you happy? Are you frustrated? Are you stressed out? Are you overwhelmed? Are you enjoying what you're doing, or do you hate what you're doing? Are you doing something you want to do, or doing something you don't want to do? Are you at peace with the situation you're in? These are things people are not thinking about. So the posture, your state of mind, how are you breathing, are all factors that could cause muscles to tense up. Now, Einstein once said, insanity is doing the same thing over and expect a different outcome. Your body is telling you something. When you're driving your car and the red light comes up on the dashboard telling you're out of gas, you don't put duct tape over it or take a hammer and smack the red light and say, I took care of it. Now, there is no difference in your body. When there's tension somewhere, your body is telling you that it's not at peace. Something is stressing it. Either the mind or the body is being stressed. So we have the physical stress, repetitive use, abuse, overuse, strenuous posture for a prolonged period of time, mental state of mind, emotional state of mind, as well as nutrition. If you're lacking certain nutrients, if you're getting too much of nutrients that are poor or actually causing toxic reactions in the body, that will cause tension in your body and it will affect how you perform. As well as things in the environment, allergies, pollen, dust, all those things in your environment that also could cause you to tense up. So, I have spent 35 years developing a new manual therapy. This manual therapy is a fusion between the East, ancient Chinese medicine, and the West, modern day sports medicine. I am taking into consideration acupuncture points that has been mapped out by the Chinese for over 2,000 to 5,000 years. Those acupuncture points are reflex points that are found on the surface of the body. They're almost like circuit breakers. There's 700 listed points in the body, and then there's a bunch of additional what's called ashi or trigger points. Now, whenever the body's experiencing stress anywhere, those circuit breakers or reflex points tense up. It's like the circuit breaker goes. And what happens when tension builds up in that trigger points or acupuncture points, the muscle that is related to, or the muscle that is located in, I should say, starts to contract. Now, this reflex point, whatever that reflex point is influenced by other things in and around your body. So with this, using the knowledge of the acupuncture system and the acupuncture meridians, all the trigger points and acupuncture points or acupressure points, I do not use needles, I use my hands to press on those reflex points. I could read the body. I could see when the patient comes in with a neck pain exactly which limited range of motion they have And based on that, I know exactly which muscle is too tight and which muscle is not tight enough. I could look at their posture. Is their head forward? Is their neck and head back? Is their head tilted? Is it rotated? And based on looking at the posture, I can also figure out which muscles are too tight and which muscles are not tight enough. So posture, range of motion, and then I could manually test the muscles of the neck, the shoulder, and the entire body. And I could find out which muscles are too strong, too tight, and which muscles are weak. This gives me a picture of exactly where the tension is. Now, adding the knowledge of the acupuncture meridians, I could work on reflexes that are far away from where the pain is. I could work on someone's foot or leg as well as their neck. Why is this important? Well, see, the problem is not always where the pain is. If I only treat the location of pain, and I don't figure out why is there tension in this muscle, then again, I'm just treating the symptom. But if I'm able to figure out why there's tension in this muscle, what kind of stress factor exactly is causing it, what kind of specific exercises can I do to stretch this muscle, and how can I change my behavior, my lifestyle, what I'm doing, what I'm eating, how I'm breathing, and many, many other things. So this method that I developed is therefore a holistic approach that takes the whole body and mind into consideration. And when you pinpoint where the cause of the tension is, and you release that tension, you have immediate pain relief. You have immediate improved range of motion to what's normal. And you can immediately feel how you're stronger and your performance is greater. And this is immediately demonstrated to you through tests. You couldn't move your head, now you can. You were in pain when you moved your head to a certain position, now it doesn't hurt. You were weak in a muscle, now the muscle is strong. So imagine, in a 30-minute session, you could literally feel your pain vanish away. You could actually find a way of treating the cause of your pain. And in this process, you could also learn what caused that pain. So you could change your way. And if you take those lessons to heart and start applying them, you yourself could be in control over your pain and whether you get it or not. And you're not dependent on a chiropractor, massage therapist, or a drug. Check me out, tobehanson.com. That's Tobe with an E and Hanson with an O. I'd love to take a look at you and bring you back to a pain-free life where you could perform and feel better and improve the quality of your life. Thank you.